Dr. David Banach, infectious disease expert and public health leader. When COVID-19 hit Connecticut, one of the doctors leading the state's response wasn't a political figure or TV personality. It was Dr. David Banach, a physician who has spent his entire career studying how infections spread and how to stop them. He's not flashy, but his work is essential, and his story is one worth knowing. David Banach was born and raised in Connecticut. He liked science from a young age, but didn't set out to become a public health expert. In his undergraduate studies, he followed his enthusiasm for science, where he earned a degree in business administration and biology. It was a mix of science and strategy, a combo that would later define his career. Banach returned to Connecticut for medical school and a master's degree in public health. I always knew I wanted to make an impact in both medicine and public health, he said. Having the MPH helped me think about disease at the population level, not just one patient at a time. He trained in internal medicine and infectious diseases, and he also completed a master's degree in clinical and translational research. I wanted to understand how research connects with real-world medical decisions, Banach said. After completing his residency and fellowship training, Banach returned to Connecticut in 2016 to serve in a dual capacity as a clinician and hospital epidemiologist. His job: track infections, study outbreaks, make sure the hospital is safe for patients and staff. We're always working behind the scenes, he said. If we do our jobs well, no one notices, and that's kind of the point. At the same time, he began teaching as a lecturer in epidemiology. He co-directs a course on healthcare epidemiology. Teaching helps me stay sharp, Banach said. Students ask questions that challenge how we think about infection control. When the pandemic began, Banach was called to serve on the governor's scientific advisory group. He became a go-to voice on COVID-19 for both the state and the media. He talked to newspapers, radio stations, and local TV outlets, not for fame, but because people needed clear information. I just tried to explain what we knew and what we didn't, he said. People were scared. We had to communicate carefully and honestly. Banach was also quoted in multiple regional and national media outlets. He spoke about vaccine updates, mask guidance, and what rising flu cases meant for hospitals. It wasn't just COVID. It was RSV, norovirus, the flu. It all came at once. He said in a 2025 interview, "We had to be ready for everything." Dr. Banach has published over 60 peer-reviewed journal articles. He's written about antibiotic resistance, infection rates in hospitals, and how to evaluate penicillin allergies. In one recent study, he explored Paxlovid use in Connecticut's most vulnerable communities. In another, he helped write a series of pandemic preparedness statements for the Society for Healthcare Epidemiology of America, SHEA. Preparedness isn't just about having masks, he said. It's about having systems, data, and trust. Banach is a past president of the Connecticut Infectious Diseases Society. He also works with the state's Department of Public Health. Collaboration is critical, he said. No one controls a pandemic alone. Students and residents often name Banach as one of their favorite instructors. He's won multiple teaching awards, including the First Year Teaching Award and the Fellowship Teaching Award. He says he learns just as much from teaching as he gives. Sometimes students ask questions that make me rethink a process or dig deeper into the evidence, he said. That's the best kind of learning environment. Outside of academia, Banach volunteers as a physician preceptor at the South Park Inn homeless shelter in Hartford. It's important to care for people who might not have access to regular medical care, he said. It reminds me why I went into this field in the first place. Banach doesn't see infection control as something that ever stops. Even when COVID fades, there will always be new threats. He said, that's why we have to keep improving our systems. He believes future challenges will include climate-related disease shifts, antibiotic resistance, and improving healthcare access. But he's hopeful. We've come a long way. The next generation of doctors is ready. Dr. David Banach isn't a celebrity doctor. He's a quiet leader, a scientist, and a teacher. He shows up, does the work, and makes the system better for everyone. It's not about being known, he said. It's about making a difference where you are. And that's exactly what he's doing, one infection at a time.